and we are back with Tuesday Tips. This is our weekly check-in. We discuss, wait a second, having technical difficulties.
This one we're saying, 3, 2.
Hello, you guys, and it's Dr. Vidal. We are here in Tuesday Tips. We try to meet every week, Tuesday afternoon, to discuss different topics in plastic surgery and answer your questions. Today, we're going to dedicate this Tuesday tip to men. Men in plastic surgery and men seeking plastic surgery procedures is getting more and more popular, and I am all for that. It's not only for females, it's not only for girls. Guys should also get improvements and take advantage of the benefits of plastic surgery. So I'll talk today about the most common procedures and surgeries men seek, and then obviously we'll open up for some questions. The first one and the most popular one, it's Botox. So Botox, what is Botox? It's Botox for men. So we're seeing more and more men do it, and I think it's a great alternative to get rid of. Usually men have very thick lines in the forehead and in between the eyes, and with aging it gets thicker and thicker, and it's a sign of aging, and Botox can definitely treat those lines, especially if you do it early on, can soften those expression lines and make it smoother and make you look a lot younger and refreshed. So don't be ashamed if you have those lines and you want to get Botox. It's getting more and more popular, so don't overthink it, and come and get your consultation with our aesthetic and injector specialists, Natalie and Jenny, okay? So do it, yes.
$10 unit.
Yes, so we have a special with $10 a unit, so take advantage of that. So Botox is the more common, but let's talk about the surgical procedures as well. So the first, I'm gonna show you the before and afters that I have in my page, and we can reference those, and I'll use them to explain the different procedures. The first one and most common procedure seen by men is gynecomastia. So I'll choose this case here. That this is a massive weight loss patient. So you see that in the before picture, he has excess skin in the chest. So when we have excess skin in the chest, we have to do an excision. This amount of skin laxity, you won't really see an improvement, and you see that when he's in the side view, the excess skin kind of hangs. And also the areola has been widened and distended. So those things can't be corrected with just liposuction, okay? So this gentleman also had a tummy tuck. So he had a daddy do-over. He had the chest done, the gynecomastia, and the tummy tuck. So he had the tummy tuck extended and the chest. So this is the incisions for the gynecomastia, and this is an early on result, okay? Those scars tend to fade away very nicely and are not as noticeable as they were here. This is a 6-week follow-up, okay? So over a year, scars tend to mature and change a lot, okay? So those scars tend to heal a lot nicely, okay? So gynecomastia is excess breast tissue in males. The two main alternatives we have depends on the amount of skin laxity. On him, because he had a lot of skin laxity, the best thing is an excisional procedure, removing that with a scar that is hidden in the lower part of his chest, and what's called nipple graft. So we take the nipple and make it smaller and reattach it to the chest wall like a sticker or a graft. And that way it gives you a flatter appearance, okay? So if we do, and you can see here, very flat, very gut contour, very good definition of his pectoralis muscle. He works out a lot, so that it was just shown when we removed that excess skin in the breast tissue. The other alternative, which is the most common one for not massive weight loss patients that do not have a lot of excess skin, is actually liposuction and a periareolar, or a small incision around the nipple that removes that excess thick tissue, and that is very well hidden. And with the liposuction, we can contour the chest to get more definition of the pectoralis muscle, and it's a very, very good result. The recovery is not that hard. It's not a very painful surgery. It tends to recover very easily for the first few days, a little bit of discomfort, but The most important part of this and any lipo case is the compression, and it's the hardest part for my male patients to kind of understand and wear, okay? Because you have to wear a vest compression garment for 6 weeks, okay? So I mean, and you have to stop working out for those 6 weeks for having everything settle in, skin retract, and the best results possible, okay? So gynecomastia, that's the most common one, and tummy tuck is not that common, but it is an option, especially for massive weight loss patients, okay? So let's go now to the second most common procedure, and that is liposuction. Liposuction is getting more and more popular, so I'll use this case to show you guys a lipo case and a male. So it doesn't have to change your shape. A lot of males think that if you do liposuction, I'm gonna get a waist, I'm gonna seem more feminine, and that is not the case, okay? The liposculpting or the body contouring with liposuction, it's tailored to your male anatomy. So what do? I'm gonna thin the subcutaneous fat in the abdomen. We can do definition if you're a candidate. So who's a candidate for definition? You have to get good skin elasticity, okay? If you have excess skin or saggy skin, you're not a good candidate for definition because it relies on that skin kind of attaching so you can see the definition. You can see the different layers of the animation and the creation of the muscle shadows, the midline, the obliques or the semilunaris lines, and the linea alba, which is in the midline. Also, you can, in males, you can be more aggressive with the high definition and actually create the transverse inscriptions of the rectus abdominis, which creates the six-pack, okay? So there are different levels of definition and different levels of indications, right? So if you want a more defined look, it is possible, but then you have to have, again, good skin elasticity for it to kind of reattach back, and you can see those shadows and those inscriptions of the rectus abdominis, so you can see the six-pack. You can also define the serratus muscles or the ones on the sides, the obliques, and have a very good athletic look. It is very good to combine with gynecomastia surgery because it is not good to have a six-pack and then floppy chest, you know, you have to match it up. So whenever I have male patients that want to do lipo only in the belly, I always try to encourage them to get the gynecomastia or the lipo on the chest too, and that creates a good harmony and doesn't seem like a six-pack with a very floppy chest, okay? The turtle, the turtle look. So you don't want to look like a turtle, like a belly like this with little like squares, like it's like a Ninja Turtles. No, that doesn't look good. You want a good definition and that matches your chest too. Okay. So he didn't have definition, he just wanted everything to be thinned down and then work it out in the gym, which is a great alternative too. If you decrease the subcutaneous fat, then anything you do in the gym with your muscles is gonna be seen faster and easily because the skin is basically attached to your muscles. So you go work out and you're gonna notice those changes right away. And you see that I didn't create a thin waist like a female, you know? It still has a masculine body, wider at the top, thinner at the bottom, and in the back also create that latissimus dorsi definition and empty all of this, so you in the back view you have a wider back, more masculine look. Okay, in him I did some liposuction also in the gynecomastia region, and you can see here it was more full, and I empty only this lower part to recreate the pectoralis muscle anatomy, and that also creates more of a definition of the muscles in the upper abdomen. Okay, and I'll share the third result I have here in my piece is another massive weight loss, and the reason I wanted to share this case in particular is because the tummy tuck is different. So the difference in the tummy tuck is the midline scar, okay? So this is a fleur-de-lis abdominoplasty. A fleur-de-lis abdominoplasty takes care of not only excess skin in the bottom, like you see here, It also takes care of excess skin in the center. This patient had already a fleur-de-lis abdominoplasty done by a different surgeon, but he had lost more weight afterwards, and he wasn't happy with the loose skin, especially in the lower abdomen, but also in the bulge here in the abdomen. And you can see here, then when he was in a side view, you can see the wrinkly skin above his belly button. So he was a perfect candidate to do a revision of his abdominoplasty or fleur-de-lis, removing that excess skin in the center, removing all that excess skin in the bottom here, and getting a better contour. I also did the gynecomastia in him because he's a massive weight loss, also had excess skin, and you can see a lot of that excess skin here. So all of that was excised, and nipple grafts for a better contour, better result. He's super happy with his results. He actually came back after that for a BBL, and he's healing from the BBL now. So I'll be showing the results later on when he's fully healed from his BBL. Was super happy, and I'm super happy for him because he's a great soul. I love him. So I mean, these are the most common surgeries, but anything that can be done in a female can be done in a male. I think that the taboos and the double thinking and thinking that men shouldn't be doing those things because it's more of a female thing to do is changing, and I'm very proud and very forward with all my male patients saying that it's not something for females only. Taking care of your body and making you feel more confident in your own skin shouldn't be a gender related topic. It should be just for anyone that is seeking to improve an area of their body. The other areas that are very common in males and older males is eyelids. So eyelids is a very, very common surgery, and also eyebrows. Males tend to have, like I mentioned with the Botox, very thick muscles in the forehead, and that causes the eyebrows to drop more and create more excess skin in the upper eyelid, creating like you're mad all the time, you're furious, right? That look like you're not happy. And that has a very, very easy solution depending on the position of your brows. Sometimes you have to do what it's called an eyebrow lift. And getting some rid of some skin and lifting that to create a better shape in the eyebrows. And then the eyelids, if you have loose skin, sometimes it even interferes with your eyesight. So it's good to have that check if you have bulginess of the skin, that it's coming down, making you feel tired and older. So facelift is also, neck lift is also good alternatives in males, and it's getting again more popular and more popular. Yes, so I was talking about upper blepharoplasty, but also lower blepharoplasty. Basically, with everything coming down, you can notice more the little bags under your eyes, and also that can be very easily taken care of with a lower blepharoplasty. So I hope that I think I covered the majority of the male topics, but if you guys have any questions, then I forgot one that is also very common is rhinoplasty. Males tend to seek rhinoplasty, especially for the hump, okay? But it can address any areas in the nose, the hump, the tip, the ala. So if you want to, have an evaluation, we can certainly look into your case.
Well, that was just a question.
The question. I got it.
If you perform rhinoplasty on male patients,
Yeah.
and if there's an age range for that.
So rhinoplasties, in males specifically, have to wait until you're 18 years old. So males tend to, they reach skeletal maturity a little bit later than females. Females up to 15 years old, but males need to wait until they're 18 years old.
Okay, this is from a lady, not from a man.
Okay.
After a BBL and lipo, when can I get into the pool?
So submerging yourself in water you should wait at least 6 weeks, and that's for any procedure, okay? So submerging yourself in water has a risk of infection, okay? So we want those scars to be well healed, nothing open, before you submerge in water. So pool, beach, jacuzzi, anything like that, 6 weeks after surgery.
Okay, well, this question looks is for me more than you,
Oh,
Doc.
okay.
So is the Mother's Day discount actually 20% if it's booked same day as called the 10 and the 10 and
Yes, so this was a discussion, a mathematical discussion that we had. It's 10 and 10, but it's not 20%. The math is not the same. So it's 10% off, and then of that 10% off result, you put 10% more. So it's 10% if you do it this week, and then, but if you book the same day you get the quote, you get a 10% on top of that reduced price. So if it is not 20, but it's 10 plus 10. Plus the 50 units of Botox.
Why one tummy tuck is vertical and the other done in the guys? You explained two cases.
Yes, so those two cases are two different types of tummy tucks, okay? So this one is called a fleur-de-lis tummy tuck, and it involves a vertical and a transverse incision, okay? This takes care of the excess skin in the center and the excess skin in the lower abdomen, okay? The regular tummy tuck only takes care of the excess skin in the lower abdomen, does not take care of the excess skin in the center. If you have some loose skin, it can be pulled down, but not in a vertical vector, okay? And that's the difference. This one, yeah, it's too far back, but the other one is just in the lower abdomen because he only had excess skin in the lower abdomen, and that's a regular tummy tuck.
There are implants for chest.
Yes, there are. I don't put them. I like to do fat transfer if I need to do on the male, not females. But there are pectoralis implants. I just think that they look more unnatural and that they tend to have more complications, especially when you're working out, having that implant in the muscle. It may interfere with that. So I prefer not to put them. That's it, guys. So thank you so much for all the questions. Again, plastic surgery shouldn't be for a gender specific. I think it should be for anyone seeking to improve the way they look. So if you have any questions, please DM me. And if you want me to evaluate your case, easiest way through our website, virtual consultation form, send me your pictures and I can let you know what's the best procedure for you. I'll see you guys next week. Please take advantage of the discounts, 10% off if you book with us this week on any procedure, plus 50 units of Botox. If you do it the same days, 10% off on top of that. So give us a call. I'll see you guys next week on Tuesday Tips.